Elder depression, preventative assistance. Coverage of depression screening may help more Medicare beneficiaries get the help they need. Depressed people are more likely to receive diagnoses and be treated in primary care settings than elsewhere. Research shows that elderly people, in fact, prefer to deal with their primary care provider on mental health issues, including depression. It's therefore good news that, as of last October, Medicare began coverage for a host of preventative services as part of the new healthcare law. One such service for the elderly is depression screening, as explained in an article in Kaiser Health News. Contrary to popular opinion, the elderly are not more prone to depression than other age groups. What they are more vulnerable to, on the other hand, are system-wide health problems that depression can exacerbate. There's also a generational divide that makes our current elders less trusting of psychiatric medicine and prone to associate a social stigma with mental illness. That is likely to cease being an elder problem as the current elder generations are replaced by those now in midlife, but is a problem at present. Under current elder law, Medicare now covers the cost of annual depression screening in primary care settings with no cost sharing for beneficiaries. Medicare also covers 60% of the treatment for mental health problems, including depression, under a 2008 law, which means this is not dependent on the legal fate of the Affordable Care Act. That figure is scheduled to rise to 80% in 2014. As anyone who is familiar with elder care knows, the cost of health care for the elderly is a powerful issue for New York estate planning and New York asset protection. Annual screening for depression may help to head off not only this mental illness itself, but also any complications from it affecting other areas of health. It would make sense, then, to take advantage of the new Medicare coverage for preventive treatment and diagnosis. It makes sound financial sense and, even more important, can improve the quality of life for elders potentially suffering from depression. David Parker is an estate planning and elder law attorney.